If you're one of the millions of people recovering from Omicron infection and still have a constant phlegm lodged in your chest and throat, unable to get rid of, and coughing too much is hurting your throat, watch this video. I will show you some phlegm mobilization exercise that will help you get rid of it without hurting your throat. Not too many people know about them. It levers on your body's energy to give you a benefit with the minimum of effort. Conserving your energy to heal your body without medicine. And I'm using this technique to help you get rid of your phlegm. So let's not wait any longer and let's go through it together. Hi, my name is Lily. I'm a physician, formerly trained in pain management and medical acupuncture. I'm also a Qigong instructor, now turned an online health educator. In this channel, I will show you how to heal without medicine step by step. Recovering from the Omicron virus infection can leave you with a constant phlegm production that you can get rid of despite drinking tons of fluid and taking decongestant. If this is your case, then you will probably want to try this method. It is a part of a 5-step strategy to clear phlegm forever from your airways. I made a video about this strategy and I would suggest you to review it first, and you can click here. The phlegm mobilization exercise you're about to watch is going to accelerate your healing, especially if you are in the recovery phase of the Omicron viral infection or any other respiratory infection for that matter. That doesn't mean that if you're in the acute portion of the infection, you cannot do it. You can, but you may have to be patient with your body, awaiting for the inflammation to go away. This mobilization exercise is going to bring the phlegm up into the upper portion of your airway for you to cough it up easier and thus clear your airways. Before I demonstrate this exercise, I want to talk about the best way to cough without injuring your throat and vocal cords. It's important that you cough from your abdomen using your abdominal muscles, because when you do, you'll be using your diaphragm to move the phlegm more efficiently. Why? Because when you cough using your abdominal, you move a greater volume of air. Watch the anatomy of the lung. Most of the air is located at the base. When you cough using your upper respiratory muscles, as you can see in the figure on the right, you move just a small volume of air. It's an inefficient cough. Whereas moving the abdomen to cough, as seen on the left figure, uses the diaphragm. The diaphragm is closer to the bottom of the lungs, therefore it moves a greater volume of air. And if you do it forcefully, as in a cough, you'll be moving through the tenacious phlegm more efficiently. Moreover, there are other benefits of using your abdominal muscles. Your entire body will be better oxygenated and your posture will improve. Breathing from the abdomen will relax you more. And when you are relaxed, your airways will open up more, making more space for the phlegm to move around. You do not need to do effortful abdominal crunches if you don't wish to. Practicing this phlegm mobilization exercise will also work out the abdominal muscles by themselves, providing all the benefits I mentioned before. Let me show you in a fast motion the whole exercise, just so you can have an idea. Okay, let's do it together now. Start with thumping your chest. Make a flat fist with your hands and thump over the center of your chest, always on the same spot. Then with your fingertips, tap below the collarbone, just gently. And then tap on the side of your chest at the level of the nipples. Now for the rest of the exercise, I'll be explaining them in 3 different parts. First, I'm going to be explaining the abdominal component. Second, the arms and the body movement. And third, the lips and the tongue positioning. During the abdominal component, place your 2 hands over your abdomen, below the belly button. In this exercise, the hands will just rest and not be active. They are there only for you to sense the movement of the abdomen as you push and pull the abdomen back and forth. So let's begin pushing your abdomen slowly out. Stop for a second and pull it back slowly. Now the next instruction is to make you aware of the air that enters your nostril as you move your abdomen. Notice that when you move your abdomen out, the air enters the nostrils and vice versa. On the next breathing cycle, move your belly out and allow the air to enter into your nostrils, and exhale the air through the mouth with the lips pursed, as in kissing. Now I suggest you to stop the video, rewind, and repeat this part. Now moving on to the arms and body movement. Each movement has an organ name just for reference. Movement of the lung 1, movement of the kidney 2, movement of the liver 3, movement of the heart 4, movement of the spleen 5, and the triple warmer. So let's begin describing the movement of the lung. Sit comfortably with the feet flat on the floor towards the edge of the seat, leaving about 6 inches off from the back of the chair. Place your hands resting on your lap with the palm facing up. Inhale and raise them up and begin rotating the forearms so the palms are facing up to the ceiling. Exhale and bring them down to the initial position. The kidney movement. Sit as above. Inhale and lean the body forward, hugging your knees with your arms. Keep looking down. When you finish exhaling, come back up with your chin down. The liver movement. Begin inhaling, raise both of your hands to the side, clasp them above your head, rotate the wrists so the hands are facing to the ceiling, gently lean the body towards the left. Finish exhaling and bring the arms down. The heart movement is similar to the liver movement, but the body leans to the other side, to the right. So again, when you finish exhaling, bring the arms down. The spleen movement, inhale and put your 2 hands over the diaphragm. Exhale, and when you finish, rest your hands over your lap. The triple warmer movement, inhale and raise your arms. Exhale with a smile as you are bringing your arms down. This exercise may trigger your cough reflex because they're mobilizing your phlegm. But remember to cough from your abdomen and with an open throat to avoid injury. Let me explain you the last part of this whole exercise before we put it together. Now I'm going to explain to you the lips and tongue positioning. Each of these tongue positions will emit a sound, but the sound, how it sounds, it doesn't matter. The most important thing is how you position the lip and the tongue. So let's begin with the lung sound. So when you inhale, raise the tongue towards the roof of the mouth and exhale, allowing the air to flow out between the raised tongue and the roof. Do not touch the tip of the tongue to the roof. Just leave some room for the passage of the air as you exhale. For the kidney movement, when you exhale as if you are blowing a candle. the liver sound for the liver movement. Exhale as if you're shushing somebody. For the heart sound, exhale with the tip of the tongue rolled down, touching the floor of the mouth. For the spleen, there's no sound, but then as you exhale, you're going to pretend you are gagging as you exhale. And the triple warmer, exhale through a smile. Repeat each of the movement 3 times. So 3 times the lung movement, 3 times the heart, 3 times the kidney, and so on. As you can see, there are 3 moving parts in this exercise. The abdominal component, which is just to teach you how to breathe through your abdomen. And this is going to go synchronized with the arms and body movement together with the mouth and tongue positioning. So don't worry, as you practice this, it's going to just come very easy. I know that at the beginning sounds very complicated, but it's not. So now let's put them together. Make a flat fist with your 2 hands and thump over the midline of your chest, just like a gorilla will do, always thumping on the same spot. Then tap below the collarbone on both sides with your fingertips. And finally, tap the side of your chest at the level of the nipple to activate the acupuncture points present in this area. Okay, let's do the lung movement. Begin by resting your hands on your lap with the palms facing up. Inhale and raise them up and begin rotating the forearms so the palms are facing up to the ceiling. Exhale by raising the tongue towards the roof of the mouth. When you finish exhaling, bring your arms down. The kidney movement. Inhale and lean the body forward, hugging your knees with your arms. Look down to the floor and exhale as if you're blowing a candle. Keep blowing to the floor, and when you finish exhaling, come back up, keeping your chin down. Inhale and raise both hands, clasp them above your head, rotate the wrists so the palms are facing to the ceiling. Gently lean the body towards the left and exhale as if you're shushing someone. When you're finished exhaling, bring the arms down. The heart movement. Raise both hands, clasp them above your head, rotate the wrists so the palms are facing to the ceiling. Gently lean the body towards the right and exhale, rolling the tongue down. When you finish exhaling, bring the arms down. Spleen movement. Inhale, put your 2 hands over the diaphragm. Exhale, gagging. And when you finish exhaling, rest your hands again over your lap. Triple warmer movement. Inhale and raise your arms. Exhale with a smile. When you finish exhaling, bring your arms down. And that's it. Check how you are feeling now. Remember, you can always pause the video and rewind it and watch it as many times as you can until you get the movement. Practice this exercise as if they were medicine. Do them 2 or 3 times a day until your airways are clear. Now, if after practicing this phlegm mobilizing exercise, you continue producing more phlegm, your digestive system in the energetic way, this is just from Chinese medicine, may be weak and is not sending enough energy to the respiratory system. And I'll be talking more about what to do about this situation on my next video. So remember to subscribe to be alerted for the next video release, and thank you for watching.